HIV, non-monoclonal antibody candidates in preclinical development, such as peptides and small proteins blocking entry. With regard to polymerase inhibitors, the FDA has already approved remdesivir from Gilead. And just this past week, we've heard of molnupiravir from Ridgeback Biotherapeutics and Merck, in which they published the preliminary analysis of their phase 2 trial that showed a quicker decrease of infectious virus in participants with symptomatic disease. Just 2 days ago, Atia Pharmaceuticals reported favorable safety and pharmacokinetic data from phase 1 trial, and Pfizer now is in a phase 1 trial with the protease inhibitors. I show this to the group because this is really the beginning of the phase of looking in a strategic way for direct acting antivirals, which are going to be used to prevent people from progressing in their disease, namely keeping them out of the need for hospitalization. And on this final slide, for those of you who want to get more detail, just this past November, the NIH had an NIH SARS-CoV-2 antiviral therapeutic summit looking at the state of therapeutics, gaps in the field, and a number of our public-private partnerships. You can get this on the NIH website, and I encourage you, for those who have any interest in it, to take a look at that, because that is the direction that we will be going over the next weeks to months to years. I'll stop there and hand it over to Dr. Marcella Nunez-Smith.
Thank you so much, Dr. Fauci, and good morning to everyone. I'm going to talk, of course, today about equity, and you've heard us describe that equity is at the foundation, the center of this administration's COVID-19 response. Over the last month, in my time with you, I've detailed why that needs to be the case. So we've taken a look at the differences in COVID-19 outcomes, for instance, by race and ethnicity. And since the beginning of this pandemic, we have all seen that factors, like race, ethnicity, rural versus urban geography, poverty, disability, living situation, and type of employment, they all are exerting tremendous influence on the outcomes we see in COVID-19. So I want to begin this morning by giving an update on the ongoing inequities related to COVID-19. So first, let's take a look at the rates of COVID-19 cases, deaths, and vaccination by race and ethnicity. As you can see here, Latino individuals continue to bear more than their share of COVID-19 cases, while Black people continue to bear more than their share of deaths. Notably, you see the share of vaccinations is significantly lower for Latino and non-Hispanic Black individuals relative to their share of the general population. And the same is true for Asian individuals. But this all still only tells part of the story, as we remain limited by the completeness of our data. We only have race ethnicity data for 53% of those who have received their first dose of a COVID-19 vaccine. This varies widely among the states, as you can see on the next slide. And we're not getting from individuals, from providers, and from states the critical information about who has access to these 3 life-saving vaccines that need to be equitably distributed across our country. So I want to emphasize here, it is possible to do better. The final slide shows us the information that providers and states are reporting to us and the age of people who they're vaccinating. So contrast that with the data on the race and ethnicity of those same individuals. Again, we have critical ground that we must make up, but we cannot get discouraged or feel like it's insurmountable. All of the evidence points to one simple truth: we can do this. So like many of you, We've also seen a lot of conversation about vaccine confidence, about how some communities, due to a range of historical as well as contemporary factors, are less inclined to believe that these vaccines are safe and effective, less inclined to trust the systems offering these vaccines, and less inclined to trust the government asking them to get vaccinated. So we still have some work to do to meet people where they are. The administration is implementing a comprehensive national public education campaign, and we've been hosting roundtables with key constituencies to make sure that we get that effort right. We're building relationships with trusted messengers all over the country to make sure they have the best information possible to share with their communities. But we cannot, and we will not, accept that these differences in vaccine confidence are the end all and be all of the difference in vaccine uptake that we're already seeing. In the context of inequitable systems, we must take significant steps at every level of intervention to bend the vaccination process towards justice. Now, our success depends on our ability to build a robust and coordinated effort at the local, state, and federal level to overcome all of the dynamics that are in place. And this moment absolutely calls for that kind of effort. So in light of everything that we've seen in the 84 days since our nation began administering COVID-19 vaccines, we're turning up the expectations for this vaccine program on all fronts. And we have a series of federal programs that are a key part of our approach to ensuring that all communities have vaccination access. First, we have our large community vaccination sites all over the country. So far, we have over 580 operational federally supported sites, and over 170 sites are actively receiving on-site support by federal personnel. And we've also been able to stand up a series of federally established community vaccination centers. And by the end of this week, we'll have 18 of those sites running across 7 states with the ability to administer 61,000 total shots per week. And each of our federal sites has been designed with key equity-oriented features. So targeted geographic eligibility, weekend extended hours, reserve slots for registration through faith-based and community-based organizations, as well as deployment alongside mobile vaccination units to help vaccinate surrounding communities. So we're going to keep pushing to launch more and more of these sites and dive into the data on each site to make sure they're achieving their goal of improving vaccine equity in those communities. Second, we have our federal retail pharmacy program. And this program features chain and independent pharmacies across the country. And as of last week, we're administering 2.5 million doses of the Pfizer Moderna vaccines, plus the additional supply that they received with the Johnson & Johnson vaccine. We designed this retail pharmacy program to ensure that 1/3 of the pharmacy sites were placed in communities with higher scores on the CDC Social Vulnerability Index. Those are populations at higher risk due to factors like socioeconomic status, the composition of the household, people of color, as well as housing types and transportation dynamics. So we're going to press toward this mark to ensure that pharmacies are selecting the communities with the greatest need. And we're going to prioritize those pharmacies that do a better job addressing equity. And finally, we rolled out our Federal Community Health Centers Partnership Program. And over the past 3 weeks, we have been onboarding the first 250 centers. They collectively serve 12.5 million people and span all 50 states. As a whole, these community health centers provide services for large numbers of public housing residents, people of color, and individuals with limited English proficiency. So as we look to the next phase of this program, we will prioritize filling gaps in our coverage to the hardest hit, highest risk communities, whether they be urban or rural. And as we double down on the reach and impact of our federal programs, we'll continue increasing our vaccine supply to the states. And as we move forward, we're calling on every state to show their work too. We're asking our partners in the states to offer clear, transparent equity goals for their residents. And we're also calling on the states to help us get the data we need to know where we are and to work with us to find creative solutions to the inequitable vaccine uptake that has already emerged in these first months of the vaccination program. So I just want to be clear that achieving equity is not an aspirational goal. This is mission critical. Absent equity, we will not be able to stop this pandemic from continuing to claim lives, strain our healthcare system, and weaken our economy. But by working together, we believe we can hit the mark. So I thank you for your time. And with that, I'll turn it back over to Andy.
Thank you. So we covered a lot of ground our report out. Before I turn for questions, I just want to maybe briefly summarize a few things that we heard today. Today, I think we've begun to describe what a world looks like where we move beyond COVID-19. Dr. Walensky outlined a first step for those of us who've been vaccinated. And I think it's important to note that as more and more people get vaccinated, Dr. Walensky will continue to update us, and that list of activities will continue to grow. Dr. Fauci outlined ongoing strategies to allow for a life post-COVID to become safer and safer. And Dr. Nunez-Smith, I think, importantly points out that this recovery is not an even picture. And in fact, we cannot fully get back to a place where we are approaching where we were before COVID unless we do an important and good job reaching equity. So I think a very hopeful morning, but with some continued warning signs and hope for the future. So with that, let's take some questions.
Thanks, Andy. And we're running a few minutes late today, so we're going to have to take a couple less questions. But first, we'll go to Ed O'Keefe at CBS.
Hi, everyone. Happy Monday.
Hey, guys.
International Women's Day.
Obviously, this
We have
is,
some special guests.
we're overlapping with the, can you hear me?
Signed two
We can hear you
executive
both.
orders.
Yeah.
The first establishes the White House.
All right.
All right.
Kevin,
We'll go ahead and go to
different question. Yeah.
we'll go to Zeke at AP.
Thanks you all for doing the call. For Dr. Walensky, I was hoping you can clarify why the CDC hasn't, what the limiting factor is in the CDC not sort of putting out guidance to the effect of those who have been fully vaccinated not having to wear masks and being able to travel and things like that. What is the limiting factor? Is it the background cases of the virus in the community? Is it the fact that not enough people are vaccinated just yet to get there? And then could you just provide potentially a step of sort of what the next set of guidance is going to be and what the triggers would be for, for people who are fully vaccinated being advised to be able to remove their masks in public and, go about a somewhat normal life?
Yeah, thank you for that question. I think it's important to realize as we're So we're doing our best to do that. I think it's also important to remember that people who are vaccinated, there's increasing data now that suggests that they might get breakthrough infections with lesser amounts of virus, lesser amounts of disease, lesser symptomatic disease, milder disease. However, we're still waiting for data to emerge about whether they could transmit that virus to other people. So our next steps in terms of putting out the guidance, as I mentioned, is really to see a larger swath of the population vaccinated. We're actively on our way to doing that, as well as to hopefully see further cases decline in the country, as well as waiting for new data to emerge. So we're hoping it's in a relatively short period of time, but we do need to see some more new data as well.
Next question.
Next, we'll go to Shira Stein at Bloomberg.
Hi, thanks so much for doing this. Can you explain what the scientific justification is for not changing the travel guidance to telling folks who are fully vaccinated that they should not be traveling? And how will this guidance affect folks' willingness to get vaccinated?
In terms of travel, here's what we know. Every time that there's a surge in travel, we have a surge in cases in this country. We know that many of our variants have emerged from international places, and we know that the travel corridor is a place where people are mixing a lot. We are really trying to restrain travel at this current period of time, and we're hopeful that our next set of guidance will have more science around what vaccinated people can do, perhaps travel being among them.
To the second part of your question, obviously it would be pure speculation on our part, but we think that this is part of a growing list of reasons why Americans do want to get vaccinated. We are already seeing increasing numbers of people wanting to get vaccinated, given the highly effective vaccines and given the very good safety profiles. And this list, which, as Dr. Walensky pointed out, will continue to grow, we think are a growing set of reasons why people want to get vaccinated. Having said that, I think it's important to note that the CDC makes its decisions based upon what the science and the data tells them are the right decisions, not for any other reasons. Next question.
All right, I'm going to try Ed one more time. I think he figured it out.
I did. Thank you. And let me follow up on the travel question there, because Director Walensky, you explicitly said grandparents now could go visit their daughter's house and see the grandkids. But in many cases, that's going to result in grandparents probably getting on a train or a plane to go to a neighboring state or some other state to see them. If a governor calls you today and says, okay, you just said people can gather in homes and this is going to cause people to start traveling despite the urge not to, what guidance would you give that governor regarding vaccinated people coming back to their state? Do they still have to quarantine for a certain amount of time? Or at this point, can they sort of disregard those travel restrictions if they've been vaccinated and have been fully vaccinated, waiting those 2 weeks after their final shot?
Our travel guidance is unchanged, and so we would maintain whatever travel guidance is currently in place. We would like to give the opportunity for vaccinated grandparents to visit their children and grandchildren who are healthy and who are local, but our travel guidance currently has been unchanged.
Kevin, next question.
All right, and final question, we'll go to Alice Park at Time.
Hello, can you hear me?
We can.
Great. This is a question for Dr. Fauci, and this has to do with the studies you mentioned last week on the third dose. Can you outline for us what the metrics are that you're going to be looking at in those studies, and what thresholds you will set for success, or to determine whether a third dose might be necessary or not?
Alice, there were two third dose scenario. One was one that Pfizer is pursuing, where they're talking about giving a third dose against the wild type virus to boost up the level of neutralizing antibodies. The parameter there will be taking a look at what the level of boost of antibody, because we do know from in vitro studies that when you get a high level of antibody against the wild type, it gives you a cushion of effect against the variant. And the third boost is one that we are doing in collaboration with Moderna, where the boost will actually be a boost of a vaccine that is directed specifically against the variant. So there are two issues there. What we're looking for in the second one is the level of antibody that we will have boosted against specifically the variant, as opposed to the level of antibody against wild type, which you will assume will give you some cross protection against the variant.
Thank you. Thank you all for joining. I hope people view this as a hopeful day in the next steps of the pandemic. And we are here in no small measure because of the safety and protection that many, many Americans have taken with regard to their family, friends, and neighbors. We ask people to continue to do that so we can get there as quickly and as permanently as possible. Thank you very much. And we'll be here again on Wednesday.